Welcome back, everyone. You're watching We Heart Therapy, and this is the series Your Guide to Therapy and Coaching. I'm your host, Anabelle Bugatti. Today, we're talking about therapy for insomnia, and we have a specialist with us today. Her name is Christine Lawler. She's a licensed marriage and family therapist here in Las Vegas, Nevada, and actually comes to us from Texas. And she's trained in cognitive behavioral therapy for insomnia specifically, and she's going to talk to us about how this type of therapy can help you sleep better at night. Thank you so much for being with us today.
Yeah, thanks for having me.
So can we talk to our viewers a little bit about therapy for insomnia and maybe define a little bit what are we talking about when we say insomnia?
So, and there are about 60 different sleep disorders, but insomnia is one of the big umbrella ones. So that is if you have trouble initiating sleep at night, if you have trouble staying asleep, or if you have trouble because you're waking up too early. So those three primary sleep disturbances is what we would refer to as insomnia.
And so how can cognitive therapy for insomnia help?
Yeah, it's actually really, really cool. So basically, when people struggle with insomnia, a lot of times we have these thought processes that then perpetuate sleep loss. So we start associating the bedroom or the bed with being awake. I'm not going to be able to fall asleep. And so probably a lot of people that have insomnia can relate to this phenomenon where you're downstairs, you're getting ready for bed, you're so tired. And then as soon as you lay your head down on your pillow, you're just wide awake. And so cognitive behavioral therapy for insomnia, we look at a lot of these behavioral practices that we're doing that perpetuate insomnia. And we also look at rewiring our association with sleep and with the bed.
And so how is this type of therapy different than something that a client might receive with their medical doctor or through a sleep study?
So a sleep study is going to look at some other medical things like sleep apnea, which is trouble, breathing shallowly in the middle of the night. A sleep study is also going to look at some like periodic leg movements or PLMs. So a sleep study is going to give you a lot of your medical basics, but you're not going to get any information from the sleep study about how to initiate sleep better, how to stay asleep, or how to not wake up too early and not be able to fall back asleep.
Right. So it sounds like this type of therapy helps train people with retrain the thoughts that might accompany their insomnia that may be helping them to continue to stay awake, and providing supportive behavior that will enable them to fall asleep, stay asleep, and initiate sleep.
Yeah. And so what we do is really just a massive overhaul of your sleep. So we're going back to the drawing board. We're starting from zero and relearning how to sleep, how to fall asleep and stay asleep as long as you are able to.
And so how would finding a therapist who specializes in insomnia be better than just maybe going to a regular therapist for sleep help?
So yes, I'm glad you asked that question, because for years before I did this training, I had so many clients that had insomnia. And so we would talk about things like sleep hygiene, or what are some helpful tips that I might have heard along the way, or things that work for me. And the thing is, with chronic insomnia, you're just dealing with a different beast. And a lot of people aren't specifically trained on how to deal with that. I knew somebody a couple weeks ago that posted on a forum for moms, and she said, I'm only sleeping 4 hours at night. Help, what do I do? And there were a lot of really wonderful suggestions by well-meaning people saying, try lavender oil, try this behavior, try that behavior. And I just had to reach out to her and I said, all of that stuff is really great if you're dealing with acute insomnia or, trouble sleeping every now and then. But if you're only getting 4 hours a night on a consistent basis, you need an overhaul of your sleep system. And so a lot of typical therapists just don't understand how to do that overhaul. But the thing that I really love about this is it's a perfect addition to therapy. And so I work a lot with therapists who will send clients to me for a sleep assessment or for some specific targeted interventions for insomnia that then benefit all of the other aims of therapy that they're doing with their primary therapist, because when we sleep better, we function better. Our depression and anxiety are decreased. Our relationships improve. Our basic needs as human beings are food, sleep, and love. And so if we can get sleep under control, then everything else just flows easier from
right, because the cost of losing sleep is really steep.
Massive.
Yeah, because it can affect your personality, it can affect your physical health, your emotional health, your ability to be mentally alert on the road, and how well you can function and make decisions and just feel like you have that mental clarity, and it affects your motivation, and how much energy you have to put into yourself, to put into life, to put into your relationships.
Yeah, absolutely.
Now, you said something that I thought was really interesting. You mentioned sleep hygiene. So what is that exactly?
Sleep hygiene is the basic things that we do to take care of and preserve sleep. So that would be something like, reserving your bed for sleep and sex and not doing anything else in bed, not reading in bed, not doing homework in bed, watching TV in bed. It would also be something like having a bedtime routine, trying to go to bed consistently at a normal hour, limiting caffeine at a certain point in the day, and just some of those typical behavioral practices that a lot of us know about. And those things are good and can be supportive, but for people with chronic insomnia, adding those things in alone isn't going to fix it.
Right, isn't quite enough.
Yeah.
That's really interesting. So if somebody wants to find a therapist in their area that specializes in treating insomnia, how can they find them?
So if you just look up cognitive behavioral therapy for insomnia, the acronym is CBTI, then you can find a directory of certified professionals. You can also look on Psychology Today, and you can search for somebody that specializes in sleep disorders.
And so you're here in Las Vegas. So if somebody is in the Las Vegas area and they'd like to work with you, how can they work with you?
So you can call me directly. My number is 949-923-0776. You can also look at my website, which is ChristineLawler.com. I'm sure we'll have it posted.
Yeah, so it'll come across the information here at the bottom as well as the description for the video. Now, you're also licensed in Texas, so you can see clients who are based in Texas, and that would be virtual, right?
Yes, so I can do online counseling with clients in Utah and Texas and all across Nevada.
Perfect. So if you're not able to come to Las Vegas, but you live in Utah or Houston, or even in Texas, thank you, then you can look her up as well. And if you're in Las Vegas, make sure that you check her out, ChristineLawler.com. We'll have that information posted. Thank you again so much for coming to talk to us today.
Yeah, thank you.
Thank you so much to our viewers for staying tuned and for catching this exciting series. And make sure that you hit subscribe because more episodes are on the way.